Hey, it's Tim at ChiroUp with Neurodynamics 101. Nerves are dynamic structures that need to stretch and glide. Let's imagine this is my median nerve, and as I begin to move, the first thing that happens to a nerve is it begins to take up slack. As I continue to move, that nerve is now going to begin sliding, and as I continue to move towards end range, the nerve now stretches. Well, the good news is that nerves can handle some stretch, but at about 8% stretch, the nerve starts to become ischemic, and at 15% stretch, there's a complete arrest of blood flow. How does this happen? It happens through mild mechanical obstructions anywhere along the nerve, from the foramen all the way down to the termination of the nerve. If there's some irritation in that area, the whole nerve swells. When the nerve swells, there's greater hydrostatic pressure, which means that fluid wants to weep out and start to create altered neurodynamics or adhesions along the way. Let's imagine my sciatic nerve. If I flex forward, my spinal canal needs to stretch 9 centimeters. Well, my sciatic nerve needs to stretch as well, so if everything is flexible, now each part of my sciatic nerve stretches an equal amount, which is hopefully less than 8% stretch. But if I have a mild mechanical obstruction that has now created an adhesion somewhere, let's say it's in the back of my thigh, when I stretch forward, now all of that stretch is taking place between the adhesion and the nerve root, which means that there are symptoms. And we know that addressing these problems makes a big difference, not just for spinal-related problems, but rotator cuff problems and carpal tunnel. In fact, one study said that carpal tunnel neurodynamics works as well as surgery. The good news is these are easy things to identify and fix. Check out this week's blog for all the details.